Hello everyone. Today we will be discussing biopsy. Biopsy is one of the principles of surgery and is very important in day-to-day dental practice. So, to coming to what is biopsy? So, you would have seen in your clinics or in hospital setup, whenever any patient comes with a swelling or an unknown pathology, we take the tissue from there and send to histopathology labs for clinical and histopathological examination. So, then a report comes. Based on the report, we do the further treatment. So, these biopsies are of different types which we will be discussing today. So, coming to what do you mean by biopsy? So, the word biopsy is made up of two words. First one is bio and the second word is opsis. Bio means we all know that is life, and opsis means the vision. So, that means we are seeing a healthy tissue or a living tissue or an unhealthy tissue. That is called biopsy. So, the definition of biopsy goes something like this. So, biopsy is defined as the removal of the tissue from the living organisms for the purpose of histopathological examination and diagnosis. So, you incise that area under local anesthesia, take that area, send it for store it in a fixative solution, send it to laboratories where they will further examine it, and on the patient where you have done the surgery, you will close it, and then antibiotics and painkillers will be given, and further maintenance of that surgical site needs to be done. So, that is the basic funda over here. So, the World Health Organization has also defined biopsy in a different way. They define biopsy is the examination of the tissue which is removed from a lesion, and by extension the term is used to convey the removal of the tissue. So, the removal of the tissue is called biopsy. That is World Health Organization definition. So, now from which all sites we can do biopsy? So, biopsy can be done from various sites. In oral and maxillofacial surgery, we can do it from the lower lip, what you can see it here, lower lip. If any lesion is there, we can do it, or from the site of gingiva, we can do it, second one, or from the lower border of the tongue or the floor of the mouth, anywhere we can take biopsy, from the cheek. So, we can do from any part of the body. So, whenever the tissue is taken, it is stored in a fixative solution. So, around 20 to 30 minutes it is stored in a fixative solution, and then it is taken, the lid is closed and it is taken to the lab. So, that is what basic thing what we know. So, this is biopsy. So, why do we need biopsy, or in other words the indication of biopsy, what I am going to talk about right now. So, coming to the need for biopsy. So, any lesion which is clinically suspicious, you see a lesion very drastically or at a very fast rate, the tissues are changing, the color is changing, the texture of the skin is changing, or the growth is happening. So, clinically very suspicious. So, that is indicated for biopsy. Second one, to confirm a presumptive diagnosis made on clinical and radiological finding. You got clinical finding, the tissues are changing in color and texture, and radiology also tells that there is some bone loss happening. So, clinically and radiologically some changes are being noted. So, how to confirm it? So, the confirmation will be done by sending the tissue to the histopathology lab by doing biopsy. So, with the biopsy the confirmed report will come. Next one is when the dentist cannot reach to a definitive clinical diagnosis. So, you have a clinical diagnosis, a radiological diagnosis, but a definitive diagnosis is not there. The confirmative diagnosis is done only after the biopsy report, that is histopathology. And based on biopsy report, the treatment plan is made, whether a surgery has to be performed or the chemo has to be performed, whether it is a malignant lesion or it is a benign condition or whether it is a cancer. So, all those things will be determined, and based on that a further course of treatment is given. So, these are some of the few needs for biopsy. And the other needs is it is a valuable in self-teaching diagnostic aid. So, our clinical diagnosis we made based on our experience, based on radiology we got a report. So, to check whether our diagnosis is correct or not, biopsy gives a valuable aid. And biopsy is done in cancerophobic patients, like patients who are very particular about their tissues or skin on any part of the body. They are not comfortable with that extra growth. They want to rule out whether cancer is there or not. So for them, you can do a biopsy and the reports will tell everything. And it is also very important in maintaining a medical legal record. So later on, the patient should not say that because of your treatment it started earlier. Only when biopsy is done, you will get an idea what the patient was having or what lesion he was having. So these are the need for biopsy. In this condition, we should go for biopsies. Now next coming to that is the indications for biopsy. So there are n number of indications. First and foremost, the first indication is any lesion which is persisting for more than 2 weeks, 10 to 14 days, any lesion was there, you gave a traditional antibiotic, painkiller or some ointments, but no healing took place. The situation is still the same or it has become worse. So in that case, you should go for a biopsy. And then the lesion is not responding to local treatment for 10 to 14 days, you should go for biopsy. So any lesion staying for 14 days, you should go for biopsy. Not responding to treatment, you should go for biopsy. And any persistent hyperkeratotic changes in the soft tissues, the skin texture is changing, hyperkeratosis is happening, then also you should go for biopsy. So coming to the indications for biopsy, so any persistent tumor suspected being neoplastic. So you have a swelling, the patient has a swelling and you feel that transformation is taking place. Some metaplastic or dysplastic changes are taking place. Then definitely you should go for biopsy. And then inflammatory changes for some unknown causes. Inflammation is there, some unknown causes and it is persisting for a very long period of time. You should go for biopsy. And any infections or lesion that interferes with the local function, we should go for biopsy. And any tissues which is surgically excised, that also you should go for biopsy. And any tissue spontaneously which is expelled out from our body, if any tissues is expelled out, that also you should examine what it is and why it happened. So these are few indications for biopsies. Coming to the further indications, and any swelling or draining abscess is there or sinus. Sinus is one-way opening. Fistula is two-way opening. So if material from a persistent draining sinus whose source can't be identified, then you should go for the biopsy if there is a draining pus or sinus is there. Any bone lesions not identified clinically and radiographic findings are not supporting bone lesion is there, then you should go for biopsy. And any lesion which has characteristics of malignancy, which we already discussed, any neoplastic changes or dysplastic, metaplastic changes, hypertrophy, hyperplasia is happening, then also the tissue you should go for biopsy. So this were the indications for biopsies, almost some 10 to 15 indications we discussed. So now coming to the contraindications, that means we should not do biopsy. First and foremost, biopsy should not be done in a patient whose general condition, who has a very poor general condition, very weak, anemic, less weight, looking very pale. So definitely wherever you do the biopsy, healing will not be fine. Or if there is a diabetes, so in incisions you are going to put, healing will be difficult over there. So the second indication will be any acute virulent pyogenic infections. If there is some bacteremia in the body, the patient is having fever or some already infection is there, then the whole generalized infection of the body, in those cases also you should not go for biopsy. Let it subsidize and then you can go for biopsy. And any patients who is having any blood related problem, that is blood dyscrasias like hemophilia or von Willebrand factor disease, or any of the factors are deficient and healing problem is there, then you should not go for biopsies. And any tumor or any tissue origin, anything which has got vascular origin, blood related, arteries related, so those kinds of tumors also like hemangiomas, you should not go for biopsy immediately. You have to rule out everything and if indicated, then only on a controlled atmosphere where you have backup, you're doing in a hospital, you have got a blood bank, you can do a surgery and save the patient, then only you should do. This comes under almost like absolute to relative contraindications.